I'm Shannon Weber with HIVE, and we're here in Vancouver, Canada. It's July 2015 at the International AIDS Conference, and I'm talking with
Pietro Vernazza. I'm from Switzerland, and I'm the president of the Swiss Commission on Sexual Health. So we're making recommendations for HIV and other sexually transmitted disease.
And we were having an interesting conversation about the topic of breastfeeding, women who are living with HIV and breastfeeding. And here in the US and Canada, we've been having a dialogue among clinicians and activists about the practice of just telling women they can't breastfeed and then not finding out maybe if they have grief around that, if they're leaving care because of that, what their concerns might be, if there's cultural implications in their community. And you were telling me that this has also been something you're thinking about in Switzerland, but from a slightly different perspective.
Yeah, so we are trying to get our new vertical transmission recommendation out by the end of this year, and breastfeeding is one issue in that discussion. And when we looked at the data, we realized there's really no good data that you could cite that tells you that once you're fully suppressed, you can transmit the virus. There's always, a few cases, but you look at the literature, you never know, is it really suppressed? Or if you ask the investigators, they tell you, yes, this mother stopped treatment, and then possible transmission by a breastfeeding might have occurred. But even if it does, the risk seems to be very, very low. And then we had discussions where we realized you have to balance this very low risk that seems to be nil with the risk of not breastfeeding. And we know in the third world this is an important topic, and it's really, if you use formula feed, this is associated with increased mortality, which is not the case in Switzerland. But there are many other health benefits for the kid, his immune system, but also for the mother. For instance, risk of breast cancer appears to be reduced in the mother. So before we just go and tell the mother, hey, you should not breastfeed, we thought there are two very low type of risk, and it's very difficult to say which one is the bigger or the other. And if you have such a situation of equipoise, theory about ethic dilemmas tell us that this is a situation where you should include the patient in this decision making. So you should come up with a shared decision making process where this partner, where this patient should actually be involved and understand why this or the other option is selected. So a woman might decide for herself, oh no, it's important for me, to breastfeed my child because of immunological advantages for the child or for my own health, or no, I'm pretty much afraid that this very small risk of transmission might actually occur to me. I'm not sure how well I will take the antiretroviral drug. I realize I have to take it every time. I'm not sure I can do that. So this is something that the patient has to discuss with the physician. So that's why we think we will say in our final recommendation, I hope, that this is a discussion that is open. A woman can certainly breastfeed, but it needs to be discussed together, and the decision should be based on the knowledge about the different risks.
What has been feedback from the pediatricians on this topic? Because I think that it's when we come from a woman-centered perspective, sometimes we're missing that voice about this infant-centered perspective. And a pediatrician who's standing right here would say, listen, but one, infected infant is one too many. You don't know what this is like. You haven't cared for an infected infant, and we can prevent this. So how do you also balance that in this conversation?
It's certainly important that for such a recommendation, you have pediatricians, gynecologists, and infectious disease doctors on board. That is what's going on in Switzerland. And the pediatricians are less concerned about possible infection of the child. They also agree if you have a well controlled antiretroviral treatment, we don't see any risk that HIV could be transmitted. But then they say there is limited, some antiretrovirals that go in the breast milk, and the child will get part of the antiretrovirals. But you know, the fraction or the dose that the child gets is like less than 10% of what a child would get if you give him, for instance, post-exposure prophylaxis for 6 weeks, which pediatricians for many years or decades now found that's okay to give. So I think you also have to balance this, all of that, and it has to, all these aspects have to go into the final decision.
Yeah, I can't wait to see this unfold, and we keep the dialogue going.
Thank you.
Thank you.